Jordan is a professional performer who's about 7.5 months removed from an ACL reconstruction, and she recently started going back to ballet class where she noticed that she was having a lot of trouble getting into a grand plie. The deeper she got, the more discomfort she would feel in the knee and almost feel the need to shift off that weight and into the other side. So in today's session, we focused on it and tried to get it back. We started off with some manual therapy to reduce as much tension as possible through the quad and get it ready to activate and be able to control that range of motion.
Manual therapy.
We then did some very simple mobility and hip drills just to kind of grease the wheels and prepare the body for movement.
You should do.
Today in the gym, we started with single leg
strengthening
strengthening exercises, focusing mainly on glute strength and activation. They included standing hip abduction.
So now what he's doing is he's teaching the muscles to activate appropriately instead of just giving her some exercises unsupervised. I think that's a big rub I have with most physical therapy practices is they give them exercise and they walk away. When really one-on-one therapy saying, no, move your body this way, no, move your body that way is really important because a lot of times patients, and it's not your fault, but you'll do what we call compensate. You'll compensate the movement because you're not moving properly. And so you'll do the exercise wrong and you'll retrain the muscle incorrectly and then not necessarily get all or any of the benefits.
Standing hip abduction, this reverse step down variation, along with a single leg RDL. After that, we added 2 exercises designed to build strength and control in that end range of motion to help her grand plie. We started with this sissy squat variation and then moved on to this exercise where she brings her leg up into a passe, places her toes on the box, and then shifts all of her body weight to replicate that end range of motion in the grand plie. We did 3 sets of 5 of each exercise and then retested. And wouldn't you know it, by the end of the session, she was getting down into a full grand plie and had the ability to smoothly rise right back up.
That's amazing. That's physical therapy. That is what physical therapy should do, right? We should be using our skills to assess movement, do some manual therapy to promote good movement, and then some mobility and some other exercises to reinforce good movement, and then strengthen that good movement. That's what we do. We want to get good movement. And that actually tends to be the main reason why people get better in whether it's a physical therapy or any other movement specialist. That's why people get better. So well done.